Hey guys, thanks for joining me for another Dinner with the Doc. And tonight's talk is going to be about shockwave therapy, which is a really cool new treatment modality that our practice uses. So we'll jump right in and talk about it. So what shockwave is kind of a layman's term. Really, it's called extracorporeal shockwave therapy. But basically, we just call it shockwave. And usually when you call us about shockwave, we know what you're talking about. And it's basically a treatment that we use for orthopedic, or bony and soft tissue injuries. And so what shockwave is it's a machine that generates pressure waves, and these pressure waves are made outside the body, and those pressure waves move through fluid and tissue. And so what we use it for is, the big thing is to reduce inflammation. And so the thought behind, scientists aren't really quite sure how shockwave works. The thought is that it breaks up inflammation, so then it allows for healing factors to kind of move through that inflammation. So the big thing it does, like I said, it reduces inflammation. It increases blood supply or neovascularization to the area, and then they also know that it causes osteogenesis or bone growth and renewal, and so that's kind of how it works on the microscopic level. They've studied it, and they know that tendons that we use shockwave therapy for, they tend to heal faster, and they actually tend to heal a little bit stronger. That's always a worry about a tendon injury in a horse, is that that when they lay down scar tissue in the tendon, it doesn't have as much strength as the original tendon that was there. So re-injury is always a big issue. Well, they've done the test with shockwave, and they know that those tendons, when they heal, they have a higher tensile strength, or their ability to stretch, than tissues that didn't use that. And the other cool thing about shockwave is that it has a pain relieving effect. The big factor this comes in is before a show. You're actually not allowed to use shockwave before shows. But what it does is it actually causes the area to go numb. So horses that are experiencing lots of pain or swelling or inflammation or lameness from an injury, that we can use shockwave, and that kind of helps them not only heal, but also gives them a pain relieving effect. We've found that when we use shockwave, that it does work better initially, right after an injury. It tends to not work as well when you use it further out from an injury, several months down the line kind of thing. And some common, things that we use shockwave for, tendonitis is a big one. So any tendon injury, tendon tears, tendon holes, you can get desmitis in a tendon, which is that you get some calcification in the tendon. We use it for cortical bone fractures, and so those are fractures where you have only a fracture right through the very edge of a bone, so that causes them to kind of fill in and heal faster. We use it a lot with arthritis, so DJD, which is in the hocks, fetlocks, knees, those sorts of things. And another very common one that we use it with is in navicular disease. But pretty frequently we also use it in sore backs, sore SI joints, necks with arthritis, those sorts of things. And the cool thing about shockwave is you can actually use it to treat a tiny little hole in a tendon, or you can use it to treat the entire back of an animal. So kind of what we usually do with shockwave is it's actually, our unit's a portable unit, and most shockwave units are portable. But what we do is we bring them up, and we a lot of times do them stall side. And the first thing that we do is we come up with a treatment regimen. And so what that's based on is what type of injury the horse has, the severity of the injury, how long it's been going on, client's budget, which is another really important factor. So after kind of taking those things in consideration, we'll come up with a treatment protocol where we deliver, usually kind of a typical, shockwave therapy is anywhere from 1,200 to 1,500 pulses, but we can go up, up to 1,000, 1,000 to 3,000, kind of depending on what type of area we're talking about. Obviously, if you have a tiny tendon injury versus a horse with a sore back, you're going to have a lot more pulses on that back because it's a bigger surface area. And ideally, what we like to do is we actually like to pair it with another treatment modality. So say it's a horse with an injured tendon, we might talk to you about doing PRP, which is another thing that we'll talk about in another Facebook Live. Or we might talk about doing, if your horse has navicular disease, talk about doing Shockwave with something like Tildren or Osphos, which are, other treatment things that we do. And so basically what we typically do, the typical treatment, say your horse has a tendon injury, is that we will treat them every 2 weeks for 3 treatments. And again, it kind of depends on, budget, but also what the area is and what the injury is going on. But like I said, usually 1,200 to 1,500 pulses. And the really cool thing about Shockwave is most horses actually tolerate really well. It's a very loud machine, and that's usually the biggest thing that I worry about when I come in with the Shockwave machine. Is I actually don't worry about the horse I'm training. I actually worry about the other horses in the barn because it's loud. But it's not painful. And then, like I said, it eventually has, when you first start using it, it has a little bit of a local numbing effect, and then eventually it has that it actually is a pain relieving effect. So I would say probably about 95% of horses we don't have to sedate to do it. We can do it just without sedation, kind of standing in the aisleway or in their stall. That 5% of horses that we do have to sedate, it's usually not because of the Shockwave itself. It may be because the noise is really startling to them, or that, it's a big heavy machine, so that's what the machine's scares them or something like that. But like I said, most horses we don't have to sedate. It only takes a few minutes. I would say most treatments, take somewhere between 5 minutes, 10 minutes if it's a large area. So it's quick, it's portable, no sedation is needed. So that's kind of the cool thing about it. So like the announcement said, we're one of the few practices in the area that has a Shockwave and utilizes it. And so if you have a horse that you think that would benefit from a Shockwave treatment, as always, contact us or the office. And then if you have any questions, of course, post them in here or call or text with your questions, and we'll kind of go over that stuff. But thanks for joining me for the talk on Shockwave treatment. Thanks.